All right, a warm welcome to you to this second week of the Impact Accelerator, what we call the Launchpad. Really 4 weeks of collaboration across borders, across system levels in order to achieve a specific goal and ultimately contribute to the implementation of your action plan. Now, some remarkable results in this first week. I'm going to actually start there. This was not the plan, but we have, let me see, where is the right slide that I am looking for? I think it is here. Yes. So we have 154 scholars who've submitted their goals and actions in week one. So this is a remarkable number of people left standing after the first week, and we're just getting started. Now, a couple of technical points. If you cannot hear me yet, it is because you need to call using internet audio. So let me get out of the way here. You can see here, you need to join audio. Click here first. But of course, if you're not connected yet, then you cannot hear me yet. And then the other thing, for those of you who have bandwidth issues, you can actually download the slides from the Dropbox resource folder we've shared with you, and you can stop incoming video. I believe this is a new feature that we are seeing in Zoom, but quite a useful one. Now, to get back down to business, this is the schedule that was shared with you last week, showing you what, and this time I've pulled out just what we need to do in week 2. So you can see here there is the participation in the Global Assembly. You will be meeting your fellow scholars in your country group at the end of this session. I've already shared the Telegram country groups at the beginning of this meeting, actually before, so I'm going to share those again. And then, again, set your action for the week. Now, this time, we're not making it mandatory because we want you to do it if it makes sense to you, if it was helpful to you, to actually figure out what action am I going to carry out this week. This is not a course, so it's not about meeting some formal requirement. It's the opposite. It's about implementing in your work something that is useful to you, and you know what that is. And if setting an action last week actually helped you, we're going to discuss and hear that today. Well, then we have offered the same mechanism so that you can do it again. Now, at the end of this General Assembly, we'll be inviting you to join your country group on Telegram. And here I'm again going to, I'm again going to share those two resources. So first of all, I'm going to drop in a big file. This is the full slide deck for today. Second, I'm going to drop in the goals and actions. And then third, I'm going to drop in the list of Telegram groups. So anybody who couldn't find their group last week, you should be able to do it this time. Now, we are first of all going to catch up, and just very quickly before we dive in, we want to know if this is not the wrong poll. Sorry, let me see. Yeah. All right. This is a poll to find out how you are doing. So you should see on your screen now, even if you're on your phone, you can just go to your phone and check. You should see a first question. Did you complete your action? So this is the action that you set last week. So you choose yes or no, and it's anonymous. We're not going to chase after you if you say no. It's really with your own conscience at this point. Have you defined your next action? And then, would you like to share a lesson you learned? And do you have a success story to share? So we'll see. Yes, right now 12 people have answered, 13. So they're right now, yeah. So please keep it going till we get everybody. We should be able to get everyone to participate. Just go ahead, say yes or no. I completed the action. Yes or no, I've defined my next action. Yes or no, you'd like to share a lesson learned, and do you have a success story to share? And then we'll look at the results together once we've got around half of the folks in the room present. So let's all right, okay, we've got 60% of the room, so I'm going to end the poll, and this time I'm going to share it. Let me see if this will work. All right, so let me go to the Zoom poll here. Yep. So 75% of you said you completed your action. So 3/4. It was 90% with the Francophones in the session we just held earlier. Have you defined your next action? So less than 3/4 have defined it. Remember, this is a week-by-week process. So whatever the outcome of your first action was, focus on that second action. Next is, would you like to share a lesson learned? So 1/3 of you, that's remarkable, are ready to share a lesson learned. We'll be hearing, and we'll be spending most of this session is going to be sharing of experience, sharing lessons learned and success stories. The challenges we leave for tomorrow, where we'll be doing the second hackathon with Jenny Sequeira and Charlotte Mbu. And then the success story, do you have a success story? Over 1/3 of you have said that is the case. So I will share for those of you who are in Zoom, and stop sharing now. All right, so that's the quick poll. I'd like to now turn to Jenny Sequeira. Jenny, I know you had some trouble joining. How are you doing this morning for you? And what do you think, how do you interpret these results? It's been 1 week since we kicked off the launchpad for the Immunization Agenda 2030 Impact Accelerator. And here we have literally hundreds of people in motion. What's your sense of how things are going so far?
Hi, Reda. Hi, everyone. Great to see you all again. I think that the momentum is good. And like we talked about last week, the follow-up part is really, really critical. So I'm curious, happy, excited, and looking forward to hearing more about what everyone is doing. Thank you.
All right, wonderful. And so, again, a reminder, this is a 4-week process where each week you set an action. You decide, you pick something that you're going to do and you're going to focus on. What you choose is up to you. Why? Because you know your context. If you're going to implement something, it is not someone from afar who is going to be able to help you. It is you with your colleagues. However, we believe that the benefit of being connected to each other in this way, and we're going to experience it today, I hope, will be that we can share lessons learned, successes, and challenges. Now, at the end of this session, we'll be going to our country teams, and each country's team will be able to discuss the goals and actions. We prepared a directory, basically an inventory of all of the goals and actions, and they're organized by country. So you can see here Ghana and Nigeria, but your country is there too. Now, if we have a solution, if for those of you who are the sole representative from your country, or if you find yourself alone in the country team, please come to the main Impact Accelerator room. I'm going to show you that in a second. Okay, let me just go to the right place in Telegram. Yeah, so you'll just come here to the Impact IA 2030 EN Impact Accelerator room, and we'll be able to have that discussion. Maybe if we haven't discussed this at all, but if Jenny is able to stay, we can have that follow-up chat afterwards. Now, that's it for the update, and I just want to. All right, so we're starting to get spam on in the comments through our social media, but I just want to acknowledge a couple of the people who are, or those of you who are online with us. We're eager to move into these questions, all right? And remind us, how is your implementation? It's not how are you, it's how is your implementation? We want to know if you completed your week 1 action. All right. What happened? How did it turn out? That's what we are really interested in hearing. Second, what surprised you when you carried out your action? What's your next action? What are you doing next? You probably have a game plan, but really go action to action. And how is each action actually helping you get to the prize and keeping your eye on that prize, which is successfully implementing your action plan? Now, your action plan may change over time, but and we probably will have to change in order to be successful. But we want to know, what is your next action, and where are you in relation to the goal? Are you closer? Are you farther? And then we'll ask you to share lessons learned and success. And I want to see, first of all, if any of the following individuals, so let me see, are in the room. Let's see. And then we'll have lessons learned. So you can see there are 5 success stories shared, as well as 11 lessons learned. Let's see here. All right. Just checking to see who is actually in the room as we do this. All right. Let's go to Sati Chandra Domkati, who has a lesson learned, and let me find the lesson. Sati Chandra, are you able to speak to us, please? Sati Chandra, yes. All right.
Thank you, Reda.
Warm welcome to you. I just want to, let me find your lesson learned so we can see what we're talking about. And then I think I have the 5 questions. Yeah, I've just pasted them into the chat. So you said you had a lesson learned. You are in India. Please do introduce yourself. Tell us exactly where you work and what you do. And you said your lesson learned was about integration of private sector immunization schedule with the national immunization strategy. You said you conducted a workshop for all the nodal officers of private establishments to synchronize immunization schedule. So let's go back to the questions. We'd like to know how that lesson relates to your action plan. Just maybe start there. Remind us who you are, what goal you want to achieve, and then you have the 5 questions in front of you.
Yes. Good evening, Reda. Thanks for the opportunity. So first of all, I am Dr. Satish Chandra, Surveillance Medical Officer working for WHO in India, based at Karnataka in Mangalore region. So actually, one of the challenge in our area is the inequity in especially the urban immunization coverage. Especially our area is a little bit a risk for the migratory population, and also there are challenges in synchronizing the private immunization schedule and the national immunization schedule, because the schedule followed in the private setup and the national immunization schedule is a little bit different. So the first challenge for me is to identify the key persons from the private establishment, health establishment, and identify them as nodal officers. And through the advocacy from the district administration, we have conducted task force on immunization, and accordingly the advocacy letters were sent to the private organizations, private health institutions, to identify the nodal officers for routine immunization, strengthening in their respective institutions. So this was actually, the plan was quite long, but because of the COVID pandemic, this plan was not implemented well. It was partially covered, but we could conduct the nodal officers training just recently, and to just integrate the national immunization schedule with that of the private immunization schedule. And one good thing is that in our area, recently we have introduced the pneumococcal vaccine. So that also we have taken the opportunity of that new vaccine introduction to just bring all the stakeholders on board, and so we have sensitized these stakeholders at the first level.
All right, thanks. I'm going to turn to Jenny Sequeira. Jenny, welcome to you. We'd love to hear your comments and questions for our speaker.
Great, thank you. And this is a wonderful example of the importance of bringing in the private sector. I think especially as more and more countries have a higher percentage of urbanized populations, this will become an even greater issue across all countries. And so I think if there's others who have examples of, inclusion of the private sector, it's a great topic to share, because if you want to reach missed communities, we often think of rural and remote, but increasingly missed communities are those in any wealth profile in urban settings. So congratulations, and it's a great example of a more and more common challenge.
Thank you, Jenny. Let's now go to Enjo Andreas. Before we do, let me just remind you already that tomorrow at this time, at the same time as the General Assembly, you have an opportunity to workshop your challenge or to help someone else with their challenge. So really, this is about sharing your experience, problem solving to help you implement. Now, Enjo Andreas, I'm asking you to unmute, but it looks like you're still muted. Let's go to Deepak. Oh, okay. Enjo Andreas, please, we'd love to hear your update. Remind us who you are, what goal you want to achieve by the 3rd of December, what goal you are going to achieve by the 3rd of December, and then you have 5 questions before you. The floor is yours.
Thank you so much, Reda. I am Joe Andreas. I'm also working as the Deputy Country Manager for EPI in Cameroon. So the goal I wish to achieve in Cameroon by December is to greatly improve the vaccination coverage against COVID-19. And so the major action that I looked forward to attain was to coordinate activity and particularly sensitization of community actors within the week. That was done. Very importantly, I was able to directly mobilize health actors from all the districts in the littoral region of Cameroon, where COVID vaccination coverage is also less than 2%. And during this meeting, all of them seeing the benefits, the merits of mobile vaccination intervention, particularly door-to-door, were able to take the decision that they were all going to use that as their approach. So the focal persons from all the health districts took that as the next step, and their actors at the various levels in the districts and health areas were equally mobilized. So at this step, the goal is to get them share with us the plan of visit to various institution enterprises and the community. So that is what we are pushing on at the moment. So for me, the lesson I learned was that when the community identifies the challenge, they can easily take the good step that is expected to help us improve. Thank you so much, Reda.
Thank you, Enjo Andreas. We're going to keep listening to further updates. Andreas, I'd like to say that just so you know, the deputy director from the Ivory Coast EPI was on the call with the Francophones, and she is actually using this Impact Accelerator to help her accelerate the work on the national immunization strategy. Would you say there is anything similar going? Do you know what other Cameroon scholars are doing in the accelerator, and to what extent there is coordination? I know the team leaders are not here today, but would love to hear and discuss that further, perhaps. Yes.
Yes, thank you so much. The Cameroon team is actually working, and interestingly, almost all of the members of the Cameroon team are part of the COVID response. And at their various levels, we are all directly involved to get the population adhered to COVID-19 vaccination. And we also, the platform is helping us to share information. It's rather unfortunate that the team lead is not here. I think she would have been better placed to give an in-depth on the approach. But we are actually working in a coordinated manner with the goal to be able to vaccinate close to 20% of our target population before December. That is actually the target we have set, and we are all pushing towards that.
Yep. Understood. Jenny, do you have questions for Enjo Andreas?
Thank you, Reda. And Joe, the issue about community involvement and being involved in helping solve the challenge is something that I read a lot about this past week, because as each of you submitted your work plans and your next steps, quite a few of you had the issue of community and getting community involved in one way or another, whether it was with routine or campaigns or whatever avenue of work. So I think that the country groups, with community, the traditional leaders, religious leaders, community leaders are all very, very different in each country. And so I'd like to echo, Reda, what you said, that it's really important to talk within your country context to learn lessons about what works with community engagement within your local context. But thank you for sharing this. This is a great, another great common issue that we've been seeing.
Thanks, Jenny. And again, at the end of this assembly, you're all invited to go to your country team rooms in Telegram and speak with each other. And what we've prepared for you is an inventory of all the goals and actions by country. So, Andreas, if you're available, and we know not everyone is going to be able to be there for that, but you'll be able to find all of the goals and actions set by the participants from your country. All right, wonderful. Let's now go. Let me just check my list to see who is in the room with us, who would like to, who can update us. So, Joyce Marithi, always a pleasure to see you. To have you with us and to have you in the accelerator. Let me just check. Let me find what you shared as a lesson learned, and I've asked you to unmute. So yeah, here you are. Okay, so this is a lesson learned from Kenya. Can you tell us while everyone discovers this, we've shared the slide deck. Yes, what was a lesson you learned in week 1 of the Impact Accelerator?
Thank you very much, Reda, and everyone else. This is Joyce Mureithi, an alumni of WHO IA 2030 student. The course that the goal that I'm implementing in Kajiado district of Kenya is actually to create stakeholder awareness on life course and integration. What we have done is to identify the stakeholders that are passionate and that are willing to work with others in order to achieve our goal. The strategies being applied now is to create, to educate the stakeholders on immunization and IA 2030 so that they can support health education using existing community health structures. The whole of last week, we were very successful in that we were able to speak to the EPI team in Kajiado County, and the EPI team was very willing to work with St. John's Community Center. They actually provided us with a lot of information that they have researched on or picked during their immunization work in Kajiado. The other thing that I did is that I was interested in faith-based immunization services, simply because the church has a big say, and what the church leader says is what the congregation will say. And there's a big concentration of population in Kajiado. What surprised me as we carried this action is that people are hungry for knowledge, and people want authentic information related to immunization so that they can be able to make informed decisions. That is what is lacking. You find that the Maasai community in Kajiado are nomadic, and primary health services, immunization services are very far, like 100 kilometers away. And somebody will prefer, instead of walking 100 kilometers, they would rather go to the bush and get herbs instead of taking a vaccine or going to healthcare. That really surprised me. The other thing that surprised me, or the lesson I also learned, is that because of the immunization schedules, services are very intermittent. And this population being nomadic, sometimes they move away. By the time they come back to the health facilities, the immunization schedules have already been closed. And this has led to a lot of dropouts and other people not having to receive their immunization. Where are you in relation to the goal you want to achieve by December 3? I must say that I have achieved quite a bit, having identified a stakeholder organization, St. John's Community Center, to work with, who are now on the ground. I have also been working with the county coordinator, who is actually doing the legwork in Kajiado County. They are the ones who got in touch with the EPI contact person, and also the county director of health services. The CEO has also gotten into contact with the bishop of the diocese of Kajiado County. We have already done an introduction, and the bishop has given us an appointment for next Thursday to sit with them. So that is what we have done so far. For next week, our action plan for next week, we have planned to get hold of the community health workers leaders, and also make that appointment with the bishop of Kajiado County. And the other thing we want to do next week, if possible, is get a political leader to work with us. I must say that the Maasai in Kajiado are nomadic, and they're also very patriarchal. That means women do not make any decision related to the health of their families. And something that surprised me is that they cannot go to the health center unless the man in the family says yes. What we are going to do, or we plan to do with the creation of awareness in this community, is target the men. And we are hoping that this will help me achieve my goal by December 3rd of getting together people who matter in order to start mobilizing the communities in creating awareness of lifespan immunization and integration. I must also say that with the integration, it doesn't work very well. And the EPI person said that is one of the big challenges in Kajiado district. St. John's Community Center, we are willing and we want to work together with all the stakeholders, and that is what we are trying to teach them. One of the challenges that we had also is that one of the Catholic priests in the county, and the Catholic Church is a huge power broker in Kajiado district, did not want to hear anything about any immunization. What was very unfortunate, if you ask him which vaccines they have problems with, he cannot even identify one single one. That tells us we really need to work hard to educate the community and create awareness of the vaccines in the country. From the EPI desk, we also learned that the EPI, they are, and the immunization professionals in the district, they concentrate on the general population, but they have not had a touch of the special population. St. John's Community Center has been working for years in Kajiado County with HIV populations and other special populations. This is going to help EPI and St. John's Community Center and other stakeholders that we are going to bring in to work together with, to also reach those underserved populations. And we are also going to be able to work together to be able to reach those that keep moving from one place to the other. Definitely, there are so many challenges related to that, including resources and other tools. Because of the nature of the community, we will need a lot of help from the Geneva Foundation, from WHO, from UNICEF, and other stakeholders that we are going to identify. You realize I did not talk about WASH, I did not talk about nutrition, which are other services that are lacking in the country, and we plan to engage.
Thank you, Joyce. Thank you very much indeed. It sounds like you're thinking, there's a lot of thinking and doing that is being done together. On the challenges, I want to remind everyone that tomorrow, Tuesday, at the same time as the assembly today, you have a unique opportunity to connect with Jenny Sequeira, where I'm going to go to her next for quick feedback. But there are many, many more people who are ready to share. So I'd like to ask you to be concise as well. Tomorrow, there's a little bit more time to workshop a specific challenge, but we know when we ask you, what's the biggest barrier to your participation? You say it is lack of time. But then when we are running a course or an Impact Accelerator, everyone says, I wish we had more time, but we do not. So please keep it short and to the point, to the 5 questions on the screen. Now to go to Jenny, quick feedback, perhaps a follow-up question for Joyce about it sounds like dealing with many different things, thinking through many different things at once, and then we'll go to our next speaker. Please do raise your hand so we can identify you if you're ready to share about how your implementation is going. Jenny?
Great. Thank you, Reda. Thank you, Joyce. Joyce, you had a nutrient-dense feedback. That was a lot of things to digest. I think that highlighting the role of faith-based organizations is extremely critical. So thank you for raising that. You mentioned that with nomadic or pastoralist populations, sometimes when the children do reach a facility, they might be out of schedule, maybe too old or out of schedule for particular vaccines. And so there's a whole movement in immunization for missed opportunities in vaccination. And the WHO guidance is that, within that local context, within the district or whatever that level is, to be sure that there's enough of the vaccine supply, but then to encourage health workers to make sure you don't miss any opportunity to vaccinate. So I think trying to figure out what is the district guidance on missed opportunities for vaccination and following up on that is very important. And I know many countries who have joined this session have issues with women needing, subpopulations within their country of women needing to get men's approval before going to the facility. And so maybe that's a topic that we can explore a bit more in the challenges Tuesday sections. But I think that, Joyce, you raised many issues, challenges with integration, many other things. So thank you. But this idea of connecting with faith-based organizations, absolutely critical if we're to reach all the zero-dose children. Thank you again.
Thank you, Jenny. So we're going to apply 2 rules for parity. One is a country and the second is gender. The country rule means that if a speaker from one country has just spoken, the following speaker cannot be from the same country. And the other rule is that if a man has spoken or a woman has spoken, the following person should be another gender. Now, this is not a hard and fast rule, but we can try that. Let's go to Kaiser Parviz. Kaiser Parviz, the floor is yours. You have the 5 questions. Don't forget to remind us who you are and what goal you are aiming to achieve by the 3rd of December.
Good evening, Reda. Can you hear my voice?
Yes, loud and clear.
Yes, I am Dr. Kaiser Parviz, working in primary health care and also a team leader in National Infection Control and Prevention Program. So my goal is, my objective and my goal is to raise awareness in the community about the importance of vaccination, where the people rejected the vaccine. They say, I don't want vaccine. For example, Corona or other vaccines also. So they don't have the knowledge about the vaccine. So my goal is to raise awareness. For this awareness, I proposed a proposal to the Minister of Health that people are not coming to the primary healthcare centers or other vaccination centers because they don't want a vaccine. For those people who doesn't have the knowledge, I want to work on them to get vaccinated. In this regard, I made a one medical mobile team, one doctor, one nurse, and one health inspector. After the team, I have requested from Minister of Health department to sanction one car and one mobile and other related things, pamphlets and literature towards the print media and the oral media to help us to convince the patients. If the patient doesn't come to the PHC, I requested another thing, that we will take the vaccination to the doorstep, each and every house. Those who are not unvaccinated people will get vaccinated. So this is the paperwork I have submitted in week 1, and by the grace of God, it has been sanctioned. It has been accepted, and few questions from Minister of Health came to me. So I will answer the next week. What are the questions? He told that Minister of Health department, whatever available resources, you can't do that. That I told, no, we cannot do that. That's why I made a medical team, and I need a help from your side to get 100% vaccination. This is my first week goal and action plan. Reda?
Thank you, Dr. Kaiser Parviz. Let's go now to Boma Otobo, and then after we've heard a few updates, we'll go to Jenny for some synthetic recap and perhaps follow-up questions for some of you. So please be ready for that. Boma Otobo, welcome to you. Remind us who you are and what goal you want to achieve by 3rd of December, and then tackle the 5 questions before you, please.
Good evening, Dr. Reda and the other participants on this call and facilitators. My name is Boma Otobo. I work for the National Primary Healthcare Development Agency in Nigeria. My challenge for this period and this General Assembly is to reduce the high number of zero dose by engaging the LGAs that have been prioritized. We don't want to call them low-performing LGAs, but indeed their coverages are quite low. And did I complete the task? Yes, for week 1. And the task was to select the number of LGAs to be engaged, and that was done. And what was done was by triangulating some data to come up with that, because we have to be evidence-based in selection. So we looked at the SMART survey of 2019. We also used the LQAS scoring in the past to see which of these LGAs might qualify, those who have failed consistently and so on. We took another look at outbreak of CVD-PV2 and also measles outbreak. So some other considerations included the presence of urban slums, riverine and hard-to-reach settlements, and of course, security compromised areas. So with all of those scoring, we were able to get the number to identify them as priority LGs. What is the next action? So having set out the objective of the engagement, we would want to send out a template where the LGs can actually pre-fill before coming for the engagement meeting. And the template is just for them to identify their populations, tell us what the challenges are, tell us the timelines, the mitigation plans, and also the timelines and who is responsible, such that once we come in for the engagement, it will be something very, very snappy, since the number is quite high. So that will be done for this next week. And where am I in relation to the goal we want to achieve by the 3rd of December? We're getting closer to that goal, but just to say that the engagement would not show us the results immediately, but going down the lane, like 6 months thereafter, we should be able to evaluate and see what the impact of that engagement has been able to achieve. Sharing a lesson learned or a success or a challenge. Well, for a lesson learned, it's important that we do not just throw away the baby with the bathwater. We really need to, because if one LG is not really doing well, it means we have almost succeeded. So in as much as we're taking a look at these priority LGs, we really have to focus more on them funding and also time spent with them on the field, we really will want to go down and drill down and find out what the challenges are, because like I said, if we do not get one HEA to succeed, then it means we have all failed. So that's what we will be doing starting from next week. Thank you. Over.
Thank you very much, Boma Otobo from Nigeria. You remember the 2 rules. So first rule is gender. So we need preferably a man to speak next. And second is the country rule. So we need someone from a country other than Nigeria. And this is especially tough on Nigeria because Nigeria has more participants than many other countries. So please raise your hand to answer the 5 questions on your screen. So please go ahead. Mamfo Mafereka. Please, I'm asking you to unmute. And I've asked privately for those who had their hands raised if I wasn't completely sure gender and country, just to ask you that. Mamfo Mafereka, please unmute and tell us, remind us who you are, where you work, and what your goal is. And if we're infringing the country or gender rule, we'll live with it. Mamfo, go ahead. The floor is yours.
Thank you very much. My name is Mamfo Mafereka. From Lesotho. I'm working as a public health nurse, actually responsible for coordinating the vaccination activities within the district, which is found in the southern region of Lesotho. Actually, my big goal was just that I wanted to increase that immunization coverage of COVID-19 coverage vaccination from that 50% to 70% actually by 3rd of December. And the action that I was supposed to do was this first week, I was supposed to mobilize the resources like the cars and also especially with the horses. Because previously we didn't reach the unreached population, like very hard to reach, because that place was supposed to be reached by using the helicopter, but because of the problem of the helicopters, we had to devise another strategy to reach the communities by using the horses for those 2 facilities which had that very hard to reach area. So now I've managed to get almost 6 cars from the COVID center, National COVID Center, and I got the 4, 5, 6, 7, and another 7 cars from the partners which are available in the district. But the pending partners are just 3 of them who are waiting for their response. And also I've managed to mobilize 6 horses for the team to go to the facility, to that area, hard to reach area. So that is that was I have successfully done for the first week. So in the next week, I'm supposed to do the community mobilization in preparation for the vaccination campaign, which is going to take about 2 weeks. And next week, all the areas will be mobilized for the people. And the strategy was to go village by village and mobilizing, involving the community leaders as well as the village health workers to make sure that every community is well mobilized. So in preparation for the vaccination for the next 2 weeks, so that we can see whether we have reached the 70% or by the 3rd of December. And another thing, that challenge that I'm having now is that I wanted to have at least, because the facilities that we are having in the district, we are having 18 health facilities within the district, which are the Christian health facilities, as well as the government health facilities. So I needed at least one car for each facility to conduct the social mobilization, including the vaccinations. But I've managed to get those 12 cars, meaning that I'm still looking behind with some cars to get together. But as for the horses, actually, I got them the numbers that I needed for the vaccination. That is yes, that is what I have now.
Thank you very much, Mamfo Mafarika. Thank you so much to all three of our presenters, Dr. Kaiser Parvez, Dr. Boma Otobo, and Dr. Mamfo Mafarika. Let's go now to Jenny Sequeira. You heard three very dense, complex stories. What are your thoughts? What feedback? What follow-up questions, if you have any, for any of the speakers to make sure we get the most out of these stories, this experience that is being shared today, Jenny?
Thanks, Reda. I'd like to ask Kaiser, it's a really intriguing thing that he's working on. And there's other countries that have tested the medical mobile team approach for routine vaccination. So I just wanted to ask him, what does that community who doesn't come to the facility actually want? Getting feedback from the end people, the end users, is probably one of the most important things in immunization. So just to see, would they like the door-to-door aspect? Do they? What are the reasons why they don't come to the facility? So that's one question. For Boma, I think that triangulation of data that you mentioned that you did with the SMART survey, the LQS scores, the outbreak data. That's a really great example of using all sources of information to make evidence-based decisions. And the statement you had at the end, I think, is something we need to plaster on our walls in our offices, which is never assume that health workers have been given the opportunity to learn or have had the training. So I think a good supervisor is somebody who listens to what people are saying and can catch the lines between the lines. People will say things, but maybe they mean something slightly different. So that listening ear is really critical. So thank you, Boma, for having that ear to listen to where health workers are. And for Mamfo, congratulations on using lots of creative approaches to reach the hard to reach. Getting your 6 horses for the campaign is really critical, so you can go where cars and vehicles go. So just a word of congratulations. Thank you. Back to you, Reda.
Thank you, Jenny. And just to go to Dr. Kaiser Parvez. Yes, there was a specific question for you from Jenny, if you'd like to quickly answer that.
Yes, sure, Reda. Yes, can you hear me, Reda?
Yes, loud and clear. What's your answer to Jenny's question?
Yes, definitely. I asked a few communities, those who are not returning to the vaccination, particularly Corona, they have a wrong concept that if you take the vaccination, long-term effect will lead to most life-threatening diseases like cancer and other genetic diseases like that. They have some educated person also, they had a mind in their mind. So later we convinced that it is not like that. It is scientific committee and WHO and Ministry of Health, Saudi Arabia country, they approved, and we have all actions. I am in front of you living, and there is no such wrong conception at all. So we cleared that. So then they told my father is a bedridden and kidney transplant patient, heart patient. So it was no, don't need to come. We will come to you doorstep. So we are arranging like this. That's why I made a mobile team. So definitely we'll go and reach unvaccinated people. Those who are not able to come, those who have a wrong concept also will clear. So that we'll reach the target 100% vaccination in our district and area.
All right, thank you.
Over.
Yep. I suggest you follow up with Jenny if Jenny has any further questions. So I'm trying to decide between Emmanuel Okala and Atahir Abubakar. Would love to hear from both of you. You both have your hands raised. So let's see. Let's see who would like to speak. Atahir, yes, we know you as a longtime leader in the scholar community, as many of you in the room are. Would love to hear from you, Atahir. What's your update? Remind us what you do, where you work, and what goal you want to achieve for the 3rd of December, and then take on the 5 questions.
Okay. Good morning, good afternoon, good evening. Depending on where I'm at, Abubakar. I'm currently supporting Zamfara State Primary Health Care Board on road immunization. My goal is to improve immunization demand generation among religious leaders. So what we last week, the tasks there have been completed. We start with high-level sensitization meeting with key stakeholders who are going to support the activity. We met with CBOs, pressmen, and women groups. So we have done that sensitization with them. Everybody has now aligned with the goal and what we want to achieve. That's what happened last week. So what surprised me was most of the people engaged, the CSO, the press, and the women groups are highly, they're anticipating and they are highly anxious to support the process. All of us agree that demand generation for immunization is very poor at the community level. They left the work with healthcare providers only. It is one-sided activity. Community are left at the other side. So all the stakeholders we met last week are anxious and very supportive to support this process. So our next line of action, we want to have a meeting this week with key religious leaders and religious groups to sensitize them on the need for demand generation. Most of them, based on the previous studies we conducted, some of them doesn't know the need for immunization. They only knows that immunization is polio vaccination. They doesn't know that there are other child killer disease that a child needs to be vaccinated. So we want to sensitize them on those key child health disease that need to be vaccinated, so that we'll be on the same page with them. For them, where are you in relation to the goal you want to achieve by December? So far, we have reached an advanced stage because the goal is to create awareness and make demand generation for routine immunization by community and religious leaders so that they can own the process. I have one lesson to share. Engaging other parties when doing activity is very key because everybody has different ideas. So when you harmonize your ideas with other partners and other groups, you will achieve. Instead of doing it you alone or with people close by to you, try to expand your tentacles. Bring even non-health stakeholders into your process. They will support you and they will have valuable contribution to your process. Thank you. Reda, over.
Thank you, Tahir Abubakar. Let's have one more speaker. We're we only have 10 minutes remaining, so preferably a woman not from Nigeria. If you are a woman not from Nigeria, this is applying the country and gender principle that we use in some but not all sessions. So if you are a woman not from Nigeria, please raise your hand if you'd like to share. Otherwise, we're going to go straight to Jenny, and then, all right, let's go to... Okay, Abdul Hakim. Yes, you may not quite fit the specifications, but we would love to hear from you and get the update about how your implementation is going. Abdul Hakim, please raise your hand. Yes, please open your microphone. Do remind us who you are, where you work, what goal you want to achieve by 3rd December.
All right. Good evening, all.
Welcome, Abdul Hakim.
Can you hear me?
Yes. Where are you connecting from? Remind us who you are, what you do, and what goal you want to achieve, and then take on the 5 questions on screen.
All right. This is Abdul Karim from FCT, the Federal Capital Territory, Abuja, Nigeria. I work with WHO FCT as a technical facilitator. So yes, I did complete my action for week 1, which was to intensify sensitization. That's to reach out to the community and sensitize them on the need and importance for immunization. As immunizing their children with the basic routine immunization that are readily available. And yes, it was achieved through the in-charges and focal persons at respective health facilities in those communities. And yes, it did yield positive results, because as of last week, we had a larger turnout for routine immunization at that specific community, involving the community leaders. So they aided in mobilizing their people for immunization. It was a bit surprising because that specific community where this sensitization was done there was a bit of hesitancy with them coming out for routine immunization. So utilizing interpersonal communication and dialoguing with the community leaders, we noticed that it's actually a communication gap that's led the community towards not coming down for routine immunization activity. For next week, I plan to intensify this activity to other communities, most especially communities that we're having hesitancy issue with. So we plan to intensify this and see how it will aid in reaching our goal of improving our DHIS coverage for routine immunization to 60% minimum as at December. Then in relation to my goal, yes, that's what I plan to achieve in relation to my goal, which is improving our DHIS coverage, that's routine immunization DHIS coverage to 60% minimum. I think I've pretty much covered the.
Do you have a lesson learned that from this this first week of the accelerator that you'd like to share?
Yes, the lesson I learned is at any point, interpersonal communication is key, and in the success or in the aim for succeeding in any program implementation, it is very, very important that the community are keyed into it. So there should be community dialogue, they should be fully involved as they are solely responsible for the success or failure of any programs that has been implemented at the community level. So that is the lesson I learned, and it added to my success story.
Thank you very much indeed, Abdul Karim Adeza. We're going to turn to Jenny for quick comments. The important thing is that tomorrow at the same start time as today's assembly, Jenny and Charlotte will be facilitating a short session in which you can really dig into someone's specific challenge, and maybe it'll be yours, but maybe it'll be someone else, and you can share your experience to help come up with ideas, potential solutions, maybe different ways of trying something new. That's tomorrow at 5 p.m. We've shared the registration link in the Telegram group as well as the as in your email inbox. Jenny, thoughts on Atahir Abubakar and Abdul Karim Adesa's updates for the accelerator before we close, and we're going to close the assembly but go into the country teams. Jenny, over to you.
Thank you, Reda. I think Atahir and Abdul Hakim both highlighted, issues related to the community and to getting community leaders and groups involved. And I think Abdul Hakim, you really focused on the importance of interpersonal communication. And I know we say this a lot. It's in all the guidelines and protocols that health workers should have that one-on-one conversation with caretakers when they bring their child to be vaccinated. But, usually there's not enough time. The health workers may be tired. I think whatever we can collectively do to encourage that, just a half minute or so of IPC with a caregiver can make all the difference. And that caregiver can then share the messages with others. So thank you. I think tomorrow in the challenge section, I want to hear from a couple of the country teams of what challenges they have in coming together and discussing things as a country, because there are so many things going on within that context. It's important to have that peer group at the local level as well as this wonderful global General Assembly. So I'll call on a couple of the country leaders just to give a quick summary of how things are going with the country groups, and if there's any challenges that the country team leaders can, give peer advice to each other, because I think that's a lot of things are done when we can focus below at the subnational level. So thank you all, and looking forward to tomorrow.
Wonderful. Thank you, Jenny. And just to show what you can already access in these slides for today's session, you have 5 success stories, 11 lessons learned. So even if you did not submit these, they're interesting to read, to learn from how other people are doing, what other people are doing that is actually helping them make a difference. So I want to acknowledge Raphael Giraud, Binish Mehboub, Hudu Abdul Rahman Kitili, Emmanuel Umachi Okala, Mariati Ramat, Boma Otobo, who we heard from today, Sati Chandra Dolkati, we heard from Sati Chandra, as well as Joyce Moriti, Emanuela Chinonye Odunze, and you too can share your lesson learned, your challenge, your success story. We've shared with you the link to do that, and we'll share it again. Halima Toro, Mamfo Mafirika, whom we heard from today, Gabanga Akinola. Next steps, you can see here what you have to do. Next is the remote coffee, the session with Jenny and Charlotte and other participants. Really, Wednesday and Thursday, the only thing you need to do is focus on the prize, which is your goal for the 3rd of December, and take the actions that you've planned. Friday, we'll have the first major deliverable for the accelerator, where we'll ask you to submit what we call the individual acceleration report. And that's when you tell us with more detail what exactly you've done, how it's turned out, and so on. You can keep sharing your success stories, lesson learned, and challenges. And tomorrow again, you'll get to meet with Jenny and Charlotte. A reminder of the certification requirements here. And then finally, it's time to meet scholars from your own country. We've all been in the room together. You can now go to your country teams and connect with people. A reminder, there are 49 countries. There were initially 300 Anglophones who started the accelerator. Again, the accelerator is not for everyone. It is for the most dedicated and committed of scholars who really want to make that difference. We don't want everyone staying just to stay. We want only the most committed, and that is who we had in the room today. Thank you so much for your time today, and we look forward to seeing you soon in the country teams. We'll be dropping by if your room's meeting doesn't open right away. Don't panic. We'll be coming by to fix that for you, and we'll see you soon. Take care. Just gonna ask everyone before you go to your country teams, asking everyone to unmute.
Thank you.
Thank you.
And if you are from a country that has very few participants, you can come to the Telegram group. You're very welcome. Thank you. And if you want to go, if you're from a country that doesn't have a group, or you can't find you can't connect with your people, join us in Telegram. I'll be on the voice chat. I'm hoping maybe Jenny has a few minutes I know she's already there, and we'll be activating everybody's microphone. See you in the country team meetings. We'll be opening them up in the next few minutes. Take care.